So local anesthesia along with cortisone. How long can a person take cortisone shots?
Okay, usually we do a series of 3 shots.
That's what I thought.
Yeah, and 80 to 90% of people with acute, what we call radiculopathies, meaning pain, shutting down their legs, get better. 80 to 90%.
80 to 90%?
Yeah, especially the ones
only after they get the shots from you?
After most patients get better.
Well, I go to a gym. I belong to Gold's Gym, so I'm there like 4 days a week.
Okay.
But I will see people coming in limping, and they will still get on those treadmills and try to go. And I mean, it looks to me like the bones are, I can't see it in through their body, but it feels like they're rubbing these bones together, because when they get off, they can hardly walk.
Yeah. If you have acute inflammation, if you have acute pain, that kind of exercise, especially high-impact exercise, is not a good idea.
I don't think so either. No.
You know, if they have acute inflammation and they can barely walk, they probably need to rest and get more treatment if they need more treatment.
If I see somebody doing this regularly, they're running like crazy, and they keep going. I said, listen, one of these days you're gonna break down. I said, your body can only take so much. And I said, your legs hold you up, but you are gonna hurt your legs, and it's gonna go up into your hip and into your back. And I'm not a doctor. And believe me or not, one guy goes there, and his name is David, and he goes, I can't do this anymore. He's limping. He has a brace.
Yes.
I don't think you should overdo anything.
I agree with you.
You agree with me on that?
I agree with you. And especially if you have a problem with back pain, degenerative disc disease of your back, knees, hips, you should not do high-impact stuff.
Because he was just running like so fast. I mean, I do a bike every morning. I do 20 miles every morning on a bike.
Bike is good.
I sit down. It's a stationary bike, but I knock out 20 miles every morning.
That's that's what I advise patients after they have treatment. They say, "What shall we do next? And what shall I do next?"
I imagine they're afraid.
Yeah. So what I'll say is, if you're a swimmer, swim, because that's good. That makes your back muscle stronger, and your core muscle stronger, and you will have. It will hold your abdominal your spine together. So core strengthening exercise is very, very important.
What about curvature of the spine?
Well, the spine has normal curvatures.
Really?
Yes.
Cool. Okay.
Yeah, there is the normal curvature of the spine.
Because I have a niece who just has been diagnosed with curvature of the spine. My sister wondered what it is.
What she
so
has,
I told her you were coming today, so I'm going to ask you.
What she probably has is what's called scoliosis, which is abnormal curvature.
Yes.
Abnormal curvature of the spine.
Okay. And what can she do?
Well,
go to live like that?
It depends.
She's only 12.
She's only 12. She probably needs to see a pediatrician.
She has a doctor.
Yes. And scoliosis can cause more problems than pain.
Really?
Yes. As a matter of fact, I had a patient call me with the exact problem today in the office, and I referred him to a children's hospital because, if scoliosis is very severe, it can also interfere with breathing. It can cause all kinds of problems. So a 12-year-old with scoliosis needs more treatment than pain management.
Okay.
Okay.
I'll let her watch this tape.
Yes.
I'll let her watch this tape. What is the second kind of problems that you would say other than first back pain? Joint pain like knees, elbows, shoulders?
And neck pain.
Yes.
Neck pain is very common. Back pain is, low back pain is very common, and neck pain is also very common. I mean, it's very common.
But the first, you would say back pain.
Back pain, low back pain is the most common.
And then the shoulders and stuff.
Yeah.
Okay, we just went over this. How problematic is, I can't understand your writing here. How prevalent is the back pain for some people? Do they have to have antibiotics? Do you ever give them antibiotics or anything like that?
No, it depends. It depends. I mean, there are many causes of back pain. Obviously, if somebody has infection and they have back pain because of infection, they might need antibiotics.
So if you have you can get an infection then. If you have a body infection, it can affect you to cause you pain in your back.
No, not necessarily. If you have infection of the bones in your spine, if you have infection of the discs in your spine, that causes back pain. That is one cause of back pain. Tumors, tumors, cancer can cause back pain.
Really?
Yes. For example, if metastatic breast cancer, metastatic to the spine, is one cause of back pain. It's not the most we see, but it is one. One thing. It's one of the things we have to keep in mind when somebody comes says I have back pain.
Do you do X-rays?
The first thing we do is X-ray.
Okay.
And most of my patients who have chronic back pain, I'd say even all of my patients, have MRI of the spine.
Okay. What is radio frequency?
Oh.
I believe that's what this word is.
Yes, correct. Yes. Radio frequency treatment. When patients have intractable pain, some patients who have arthritis of the spine have intractable pain. So initially we inject a local anesthetic and cortisone into their back in what's called the facet joints.
Facet joints.
Joints.
Okay.
These are the small joints in the back. These are one of the joints that cause pain.
Okay.
In the back. They generally cause back pain only. No leg pain, generally back pain.
Okay.
What we do is we inject local anesthetic and cortisone in and around the joints. That gives the patient some relief, but it doesn't last very long. In that event, what we do is there are very small nerves there. We sort of cauterize those nerves with high temperature radio frequency waves.
Okay.
This is delivered using a needle.
It is.
The radio frequency is delivered with a special radio frequency needle.
But there is a needle in the radio frequency that you use, then? A needle?
No. We put a needle near where the nerve is, near the joint, and we connect the needle into a radio frequency generator, which we have in the room.
Okay.
And sort of cook the nerve, the very small nerve in the back that causes the pain. That gives a longer relief to certain type of patients who have back pain.
Do you sedate some of the patients before they go through these procedures?
Correct.
Okay.
90% of our patients prefer to have sedation.
Really?
Correct. These procedures are uncomfortable. And we do them in an operating room.
Okay.
Another anesthesiologist or nurse anesthetist provides the sedation in a very safe manner, and it's done inside an operating room.
The person goes to sleep is what you're saying?
Sedation, yes.
Sedation goes under?
Yes.
Okay.
Sedation. It's not general anesthesia, but sedation. Very similar to what a person who would get colonoscopy would get.
Oh, yeah.
Yeah. So that's very similar kind of sedation. Conscious sedation.
Because I know, I just had mine not too long ago, but you go under, and when you wake up, you don't feel anything, of course, while you're under.
Yes.
But it doesn't seem like it takes very long either.
Yeah, because you lose the sense of time if you're, sedated.
Oh, yeah, you can go sound to sleep and wake up throwing up and everything.
Yeah.
Do you work with many children?
No, I do not see children under 14. Under 14? Yes.
Okay.
I refer them to the pediatrician.
That's safer that way.
Yeah.
It's okay.
Yes.
Okay, here I'm having trouble trying to read your writing here. What is his question? Some of the things that you sent to me. Where we left off at.
One of the interesting things we do is what's spinal cord stimulation?
Okay, what is that?
You probably saw my article on the magazine.
Yes, I saw it.
Yes.
Yes.
Okay. In 1967, a doctor called Dr. Melzack discovered.
In 67?
In 1967.
Okay.
Discovered that applying a small amount of electrical current around the spinal cord, on the back side of the spinal cord, outside the spinal cord is called the dura, the covering around the spinal cord, relieved pain of patients who otherwise had intractable pain.
Okay.
Okay. So spinal cord stimulation is a selective application of very small amounts of electrical current around the spinal cord to reduce or eliminate pain which is otherwise intractable. Meaning,
how many times can a person go through this, or is one time adequate?